The purpose of this lecture will be to finish up the blood circulation system so then we can move up into the lymphatic system, but we need to talk about blood vessels. Now, some of these concepts will come up again next module when we talk about the heart. So just hang on to a lot of these concepts that you're about to see. When we talk about blood vessels, we are talking about these different types. We're talking about arteries, arterioles, capillaries, venules, and veins. And something that we need to drive home right away would be that your arteries and arterioles are carrying oxygenated blood to your tissues. So arteries carry blood away from the heart. Veins carry blood back to the heart, but that is deoxygenated. So the goal of circulation is to carry oxygenated blood from the heart out to every other area of your body, have those arterioles meet a capillary junction, which is where your gas exchange happens. So oxygen is dropped off into the tissues, carbon dioxide is picked up from the tissues, and then carried back to the heart via the veins, the venous system. So you've got arteries and arterioles. Arteries are the largest, arterioles are the smallest. Same with venules and veins. Venules are the smallest vein, and veins. There's all different kinds of veins and arteries, but we're just going to call them arteries and veins. But venules and arterioles would be the small ones on either side of that capillary bed. The structure of arteries and veins are very different. So something to keep in mind is that arteries are very strong and elastic. They have to be, because they are accommodating the blood pressure coming from the heart. So if arteries are carrying oxygenated blood away from the heart, the most pressure is there, because we have to get that oxygenated blood from our heart to every other place in our body. And so they need to be very strong and very flexible to accommodate that pressure of that blood moving through them. There are three layers here to be aware of, and these layers are going to be the same for veins. And we have the tunica externa here, which is going to be a connective tissue layer that connects the blood vessels to kind of anchor it within the body around all the other structures of the body, maybe around an organ or around some fat or something like that. The tunica media is the middle layer. That's going to be smooth muscle, and smooth muscle, if you have not had 215, is involuntary. So you do not control the contraction of smooth muscle. And then tunica interna is going to be the endothelium, or the very inner layer. So right through here is where blood is going to pass. So the tunica interna is the innermost layer that blood actually touches. Now, arteries have a couple extra layers or thicker layers than veins do in terms of connective, elastic, and collagen tissue. So you see this connective tissue layer right here. And then also you'll see that these layers are thicker in the arteries than the veins. And that is to accommodate that blood pressure. So we have to have that elasticity of those arteries to be able to expand and then recoil again. And that expansion and that recoiling is called vasoconstriction and vasodilation. So when your arteries expand, or you have a lot of blood moving through them, they're going to expand. That's called vasodilation. Vasoconstriction is going to be the recoiling back to its original state. That is controlled by the autonomic nervous system. If you haven't had 215, the autonomic nervous system is like the automatic nervous system, meaning that those things just happen. You don't control them. Those are kind of our vital functions being stimulated. And that nervous system innervates that smooth muscle in those vessels here to contract or relax. Okay. So if you have vasoconstriction, you are going to have, a smaller lumen diameter. And when we talk about the lumen, we're talking about the opening here. So when you have vasoconstriction, you're going to have, I'm just going to draw, here's my lumen. Here's the wall. Okay. So when you have vasoconstriction, you are making that lumen smaller. If you have vasodilation, you're making that lumen larger. Okay, so this is constriction, this is dilation. All right, so that influences blood pressure directly. So if you have a smaller opening in which to pump blood through, so if you have vasoconstriction, do you think it's going to be harder or easier to pump the same volume of blood through that hole if it's smaller? It's going to be harder, right? It's like a funnel. If you ever funneled water, like a volume of water, you can either pour a volume of water directly into a glass, or you can pour a volume of water through a funnel into a glass. Which glass is going to fill faster? The one without the funnel, right? So if you have vasoconstriction, your blood pressure is going to go up. If you have vasodilation, your blood pressure is going to go back down. That's a negative feedback response. We're going to talk a lot more about that when we get into the next module. And that ultimately controls the blood flow into the capillaries that's available for blood exchange. Other things that influence blood pressure, blood viscosity. So what is blood viscosity? Blood viscosity is how thick your blood is. And the thickness of your blood comes from how many formed elements are in your blood. And so the more red blood cells that you have, the thicker your blood, the more platelets that you have, the thicker your blood. And the more glucose you have in your plasma, the thicker your blood. And so blood viscosity, the thicker it is, the harder it is to pump that through your vessels. And so your blood pressure is going to rise. Think about somebody who's a diabetic, who has a lot of glucose in their bloodstream. A lot of times they also have high blood pressure because of their blood viscosity. It's like maple syrup. If you can think about pumping syrup through your vessels, it's going to take a lot more pressure to pump that through your vessels than it would like water. The blood volume also influences blood pressure. So as the volume of your blood goes up, your blood pressure also goes up. So volume and pressure are directly related when it comes to blood pressure. So as volume increases, pressure increases. As volume decreases, pressure decreases. So that's why if you're dehydrated and you have not as much water in your blood as you should, if you don't have enough water in your blood volume is lower. And if you're dehydrated, your blood pressure is also lower. Okay. How hard is your heart contracting? So the harder your heart contracts, the stronger that contraction is, the higher your blood pressure is going to be. And then peripheral resistance. So peripheral resistance would be the resistance in the blood vessel that's slowing down the flow of blood through that vessel. And you can think about like atherosclerosis as an example. If you have a lot of plaque buildup in that artery wall, what does that do? It makes that lumen smaller, right? Because you've got these layers of plaque around that wall that's making that lumen smaller for blood to flow. And so if you increase that peripheral resistance with that plaque, you are increasing your blood pressure. Okay. Now, all arterioles lead to a capillary bed. So we have this picture here. We have an arteriole, which is a small artery. Here's your artery. Here's your arteriole. Oh, excuse me. And then you have all these sphincters here. These sphincters are controlled by smooth muscle. And so this is your precapillary sphincter. That sphincter can open or close to accommodate more or less blood to enter that capillary bed. So if you have high blood pressure, you have a lot of blood coming through here, right? And your capillaries can only handle so much at one time, right? So maybe that sphincter needs to tighten up a little bit to control the volume of blood coming into this capillary at any given time, even if your blood pressure out here is high. So that precapillary sphincter is going to open, blood's going to enter this capillary bed, and you see red, blue, and purple. So red would be oxygenated blood, blue would be deoxygenated blood, and purple would be the point of gas exchange, oxygen and deoxygenated blood. So then after that oxygen drop off and carbon dioxide pickup happens here in your tissue, then the deoxygenated blood goes into a venule, which then goes into a vein, and then that all veins lead back to the heart. So capillaries are the smallest diameter blood vessels Because they're the smallest diameter, they can't accommodate large volumes and large pressures. And so these sphincters are necessary to help control what's being put into the capillary bed so that they're not damaged. They connect venules with arterioles, right? And then substances are exchanged between the bloodstream and the tissues. So most commonly, we think about oxygen being dropped off in the tissue, carbon dioxide being picked up. There are 3 different types of capillaries based upon the openings in their walls. So the cells that make up the walls, how tightly packed together are they? If they're continuous, those are very tight junction cells. Not a lot can pass through the wall of the capillary. Fenestrated have little holes, sinusoidal have the largest holes. So here's a picture of all of these. So here is a continuous capillary here. So you can see how tightly packed together these cells are of this capillary. Blood would be flowing through right here. And some stuff can get out, but not a whole lot, right? Water and some small gases can get out. But larger substances cannot. Now, why would that be important that that's found in the nervous system? If you're familiar with the blood-brain barrier, we don't want a lot of like bacteria and harmful pathogens and a lot of wastes getting out into the brain tissue, right? So we need to control what's passing into the brain tissue very closely. So that would be your continuous. Fenestrated. Okay, fenestrated have these little pores in the epithelial cells. So here's an erythrocyte or a red blood cell passing through there. And you have all these fenestrations so that some larger things than here can pass through, but still not super big stuff. So where would that be helpful? Endocrine system, kidneys, gastrointestinal tract. So endocrine system, you need those hormones to be able to exit the bloodstream and go out into the tissues. You need to reabsorb things like sodium and bicarbonate, maybe larger molecules in the kidney area. You need to be able to absorb different vitamins and minerals. So all of those types of things can pass through these fenestrations. Sinusoidal are going to have the largest gaps between all of those epithelial cells. It almost looks broken, right? And the large cavities, liver, spleen, bone marrow, to let large amounts of cells, blood cells, red blood cells be able to exit and leave in those capillaries so that they can be destroyed or released into circulation. So the areas that have the most capillaries have the higher metabolism. So you're talking about your muscles and your nervous system. Those things use the most energy, so they need the most oxygen delivered to them and the most nutrients delivered to them. And how do you deliver oxygen and nutrients? You put a capillary bed there. And so those things have the most dense capillary networks of everywhere. The precapillary sphincter, again, that controls the blood flow into the capillary bed since our capillaries are so small. And we have this diffusion of things happening at the capillary bed. Now, how does that diffusion happen? Here's the key here. So molecules are forced through that wall by filtration, right? A passive form of membrane transport due to a pressure, right? Which in this case is blood pressure or hydrostatic pressure. So let's draw a picture. Okay, so if you think about capillary bed here, let's say this is a capillary and this is kind of the tissue around and tissue around here. You have a pressure flowing through here, right? Blood pressure. As pressure, and there's a volume in here, right? So you don't have a high volume of fluid out here in the tissue environment. You have a high fluid environment here. Because you have fluid in here at a higher volume than out here, you have something called hydrostatic pressure. Naturally, that hydrostatic pressure is going to push fluid out into the environment in which it's lacking. Okay, so fluid's going to pass out into the extracellular space or into your tissues. Let's just say this is your skin. Okay. Now, there's also going to be an opposing force. Once you get enough fluid out here, some fluid's going to want to go back in. Why? Remember that large things can't leave the capillary. And in this case, for the sake of this class, I want you to keep in mind protein. Okay. Protein is too big to go outside the capillary. So protein is going to stay here. Protein is a solute. Okay. So as more fluid goes out, protein's hanging out here. So that's a high solute concentration. As you get more fluid out, more water out, you still have this protein hanging out here. So some water is going to want to go back in to help balance out that solute concentration, right? So some of this fluid is going to be reabsorbed. Okay. But the rate of filtration should be greater than the rate of reabsorption, at least in the kidneys, right? Now here in the skin, we want to reabsorb a lot of that fluid, right? What would happen if you had a lot of fluid leaving this capillary and never going back into the bloodstream? If you had a bunch of fluid accumulating under the skin, you're going to have something called edema. So if we're talking about like tissue, other tissues of the body, like your skin or something like that, then you want your rate of filtration to be less than the reabsorption rate. You want to reabsorb more of that fluid so it doesn't accumulate in the tissues. Okay. The kidneys is going to be a different story. We'll get to that when we get to urinary. But as far as tissues go, you're going to have some filtration happen here just with osmosis, right? Or with filtration, excuse me, because you have this pressure inside here that's forcing things out. But then you're going to have this reabsorption via osmosis because you still have solutes left in this bloodstream that cannot leave. And remember, water follows solutes. So some of this water is going to be reabsorbed back into that capillary bed. Now, what happens if you don't have a lot of protein in here? So some people that are in kidney failure and things like that have low albumin, which is the most common protein. Well, if they don't have a lot of protein in here, that fluid is comfortable right out here, right? And so they're going to have a lot more edema because they don't have any driving force, any solute attraction back into the capillary to be reabsorbed. Okay. So keep that in mind. That's kind of a tough concept, but it's a very important one at the same time. All right, so this picture is from your book. This just shows all those precapillary sphincters wrapping those arterioles. And here's your edema clinical correlation. So we have that accumulation of fluid in the tissue. It's common in usually your lower limbs, your face, things like that. Now, different causes, right? We could have an increased capillary filtration. So if we have a lot of filtration happening due to high hydrostatic pressure, meaning maybe high blood pressure, right? Then we're going to force a lot more fluid out of that capillary than what can be reabsorbed. And maybe that's not the problem. Maybe the problem is that your capillary is just not reabsorbing that fluid. Meaning, like the example I just gave, maybe the protein and solute concentration in the capillary is so low that there's nothing attracting that water back into the capillary to be reabsorbed. Or something that we're going to talk about in the next lecture is obstructed lymphatic drainage. And your lymphatic system is responsible to take care of issues such as edema so that they don't happen if they do get past, if those issues do overcome the circulatory system in terms of blood. So here's edema, right? Swelling of tissues. These are very fluid filled. This would be a normal beat. All right, so veins. Veins are different than arteries because they have valves, so they only flow one direction. They also do not have as thick of collagen layers as arteries do. They do have smooth muscle, but again, it's not as thick. And then they have the valves here as well, but they do have the tunica externa, which is the outer layer, the smooth muscle, tunica media, and the internal tunica interna. They just have thinner layers and fewer of them. So in that case, they do have a larger diameter of the lumen. And so their lumen is a lot bigger. They're also more collapsible because they're not as strong elastic wise. But they're blood reservoirs. So at any given moment, most of your blood is in the venous system. And veins carry blood back to the heart. So they carry deoxygenated blood back to the heart. And we'll talk more about that concept in the next module. But you have majority of your vessels in your body are veins, and most of your blood is in veins at any given time, 60 to 70%. Then your blood sits in your lungs or your systemic arteries, and then capillaries in your heart would be the lowest. Okay, so in this section, we are going to now talk about a lot of anatomy of these blood vessels that I'd like you to know, specific names of ones throughout the body. And then in the next module, module 4, we'll get into more of like the heart and circulation and pumping the blood through these arteries and things like that. But I just want to go through the anatomy of these arteries first. Hang on to this slide for the next module, module 4. I'm going to go over this again there. I took out the assignment questions relating to this, but you do need to be aware that this is where the arterial system begins. And so here's your heart. Here's the aorta. It's the largest artery in the body. So this should be your central hub. This is your superior vena cava, and then you have an inferior vena cava down here, which are the largest veins of your body. And so everything kind of starts here. And I'm going to draw out, I encourage you to do the same thing to kind of draw out, map out the different arteries and veins of the body in diagrams. And this is kind of where you should always begin. So when we talk about the aorta, okay, these branches off the aorta here are going to feed up towards your head and your neck and your upper limbs, so your arms. Then you see that the aorta takes a turn down, right? And that aorta is actually going to go down your thoracic cavity and then your abdominal cavity. And the abdominal aorta is what I want to focus on. So you have this aorta, this huge artery going down your abdominal cavity, and it's below the diaphragm. So your diaphragm sits right here on top of the liver. And so that's in your abdominal region. So here's your abdominal aorta. I know it looks like a lot, but these are the different branches that I'd like you to know. So the very first branch below the diaphragm here, kind of behind the liver, is called the celiac trunk. And the celiac trunk has various branches coming off of it. It has a branch coming over to the liver, and hepatic is the anatomical name for referring to the liver. It's got a branch going over here to the spleen, and it kind of goes behind the stomach right here. That's going to be your splenic artery. And then you have this artery coming out feeding the stomach, and gastric is the word we use for referring to the stomach. So those are the 3 branches off of the celiac trunk. So we are delivering oxygenated blood to the liver, the stomach, and the spleen. As we move down the aorta here, right behind here, behind the stomach, we have a start of this vessel here, which is the superior mesenteric artery. When you see mesenteric, you need to think intestines. And so this is going to feed actually the right side of the intestines. So that's going to deliver oxygenated blood to the right side of the intestines. If you were to kind of split your abdomen into right and left halves, this would feed the right side. Then we have these 2 coming out here to the kidneys. And when we think kidneys, we're thinking renal. So renal arteries, that's going to deliver oxygenated blood to our kidneys. Then we have an inferior mesenteric right here. Okay. And the inferior mesenteric feeds the left side of the intestines. And then we have gonadals right here. And the gonadal arteries are feeding the gonads, indicating either the ovaries or the testes. So what I have my students do on ground is draw this trunk out to keep it to kind of study, draw it in simple forms, right? So you have your abdominal aorta, and then you have this cross right here, or this bifurcation right here. We are going to go over those. Those are common iliac arteries. So I do like to draw that in. And I like to star my arteries. So here's my celiac trunk. And I just like to make a note that it has a hepatic, a splenic, and a gastric. And it's technically the left gastric, but if you can at least remember gastric, I'm happy with that. Then as we go down, the next branch is going to be the SMA, or what we call the superior mesenteric artery. Then we're going to have renals coming out here. So I just draw it like this. You have two kidneys, so you have one on each side. Then you have, and I'm going to do this how you would see it in the actual human body. The inferior mesenteric usually comes above the gonadal. And that's what you'll see in dissection. But here's the inferior mesenteric artery. And I like to draw it going that way and my SMA going this way so that I know that the SMA goes to the right and the IMA goes to the left. Then you're going to have your gonadal arteries here. Right and left. So if you can kind of translate all of these vascular systems into these mini sketches, that's what I would encourage you to do. Okay, so that is the abdominal aorta. Okay, now going up to the head and the neck, you've got vertebral arteries. I'm going to go over that in a second and a little bit more. Your vertebral arteries converge to form your cerebral arterial circle, which is this mess right under here, right? Here's your pituitary. And then this kind of circle, the cerebral arterial circle circles around the pituitary here. So here's your vertebral coming in along your brainstem, and then they merge to form this vessel called the basilar artery. Okay, and the basilar artery sits right underneath the brainstem here, under the pons. And then that's going to kind of divide up into the cerebral arterial circle. And we're not going to go through what all of these arteries are for this class. But this pathway would be the next kind of pathway to draw out. So you have a vertebral artery coming in from each side, converging to form this basilar artery, and then you have this cerebral arterial circle under the brain. So if you want to draw that out, I'll just help you with this one as well. So if you're looking under the brain, and I like to say like inferior, so we know what we're looking at, right? Inferior brain, we've got a vertebral artery coming in from each side, and then those are converging to form basilar. And then I would just draw a circle like this, and then you can just call this the cerebral arterial circle. And if you've ever heard of circle of Willis, that's the same thing that we're talking about. Okay, we're going to talk about the carotids. They're not pictured here, but the external and internal carotid arteries, they branch off of the common carotids. So let's take a look at what that looks like. So here's a side view. So here's where I need you to start your central hub of your drawing for the chest, like thorax. Okay, so, oops. And I'm not an artist. Here's my heart, okay? And we've got branches coming off the heart here. And this is something that we are going to go over more in detail next week. But and this is exaggerated, obviously, right? This first branch off of the aorta, yeah, here, hold on. Let me just redo that because that should have been an aorta. I'm so sorry. There we go. There's my aorta. Okay. I've got a branch coming here. I've got a branch going here. And I've got a branch coming over here. And then my descending aorta, which turns into my celiac trunk, and everything is going to be down here. Now, this first branch is called the brachiocephalic trunk. Named brachiocephalic for brachio, which is arm, and cephalic meaning head. So it's going to further branch into a branch that's going to go to the arm and a branch that's going to go to the head. Okay, so the arm branches here are called subclavian. And this would be the right side, right? Anatomical left. So right subclavian artery, that's going to go down the arm. This one here is going to be the right common carotid. That's the one in your neck, the one that you can feel your pulse in your neck. The next branch off the aorta is going to be the left common carotid. And then this guy is going to be your left subclavian. So you can see that they have partners on right and left. This one just has to branch immediately right away. And we're going to talk more about that next week, why it has to do that, why you have this brachiocephalic trunk here, and why you only have 3 branches coming off the aorta rather than all 4 independently coming off the aorta. We'll talk about that. But essentially, this is where we're starting. So we have our subclavian and our carotids here. Now, in this picture on the PowerPoint, here's your common carotid here. And notice how up the neck, it's actually going to split into an external and an internal. Okay. And they go exactly where you're talking about. So the internal carotid actually goes up into the skull. It's going to feed brain structures. We're not going to follow that one any further. The external carotid here is going to feed these outer arteries of the face and the head. And the ones that I just would like you to be a little familiar with would be this occipital artery. Occipital means back of the head. So here's the occipital artery. This guy right here is in your temporal region, and that's going to be your superficial temporal. And then here coming around your mandible, your jaw, is your facial artery. And those 3 are branches off of the external carotid. So the 3 branches, now obviously there's more branches than that. We're not going to go into all of them. But the 3 branches off of the external carotid that I'd like you to know would be occipital, superficial temporal, and facial. The internal carotid here again goes inside the skull. It's going to feed the brain. We're not going to follow it any further. Now, something else to note here is this vertebral artery. So here's the vertebral artery that I was talking about that merges under the brain to form the basilar. And it sits right here. It's a branch off the subclavian right out here. Just lateral to the carotids. Okay, and then over here, this one's going to be out here. So the branches off of the subclavian would be your vertebral arteries. Okay. All right. We'll keep moving here. So as we keep going, let's follow the subclavians now. So you have your drawing. Why don't you go ahead and take that subclavian down on one of the sides and let's continue it. So let's go into, now the interesting thing about these vessels is that they're named, as you follow the vessel, it's named something different anatomically, regionally, where it's located. So as we follow the subclavian here, look, we're on the same vessel, but it has a different name. It's called axillary, and axillary means armpit, if you don't recall that from week 1 or 215. As we follow the axillary artery down, which is the same vessel as the subclavian, we're now in the upper arm. So now we call it the brachial artery. It's not until the inside of the elbow where we actually have a division here. And this division, the ones that I would like you to know would be radial and ulnar. Okay, so these ones here are the only ones I need you to know. There's obviously a lot more in here than that, but these are the major ones that I'd like you to know. And then as we get down, now we're in the deep palmar arch. And so those are just all these palmar arteries make up these arches. So let's take it to your drawing. Okay, so we're on our subclavian here. And as we follow that down into the armpit, we call it the axillary artery. As we keep following that down, we call it the brachial. And you can draw actually like a person's arm around this if you would like to make it easier for you. And then that brachial is going to split. And remember, in anatomical position, your thumb is going to be lateral, right? And so if your thumb's lateral or towards the outside, this has to be your radial. And this would be your ulnar. And then you're going to have these join up in your hand to form your deep palmar arches. Okay. So that's just kind of what this is how I draw these out. And I would do the same thing for the leg as well. Okay. And here we are. So we're on the leg. So I'm going to go back to actually my descending aorta with my abdominal aorta. And I'm going to start there with that drawing. So just to kind of go over this real quick. Here's your abdominal aorta. So like your gonadal arteries would be about here. Coming down, now we're in a right common iliac. Notice the common iliac splits into an internal iliac and an external iliac. The internal iliac goes into the pelvic cavity. We're not following that one any further for any branches. The one that I'm interested in following is going to be this external iliac. So as we follow the external iliac down, now it becomes the femoral. So just like with the arm, depending on where it's at regionally, it's going to be called something different, right? Same vessel. So your external iliac becomes the femoral. Interestingly enough, back here, if you've had 215, there's a muscle in here called the adductor magnus. And this femoral artery actually passes through adductor magnus and goes to the back of the leg. So this femoral artery actually takes a turn to the back of the leg. And here's a posterior view right here, and goes down through the femoral condyles right here in the back of the knee. And now we call that same vessel, we call it the popliteal. Popliteal meaning back of the knee. And if you follow, still on the posterior side, if you follow that popliteal down, you're following the posterior tibial. But there is a branch here off the popliteal that's actually going to cut back around to the front. So we've come from the front to the back, and now there's a branch that's going to go back to the front again. That's going to be the anterior tibial artery. So, and it comes actually through the tibia fibula and then comes down across the shin here. But if we follow the back, then we're on the posterior tibial artery, which will then go to the bottom of the foot. And those will be your plantar and plantar arteries. Dorsalis pedis is off of the anterior tib here. This is an area that you can feel your pulse on the top of your foot. I think that one's on your homework, but the plantar arches are going to be on the underneath of the foot. So see if you can't draw this in on your diagram, go back to your descending aorta with your common iliacs and then take that one down. So that's all arterial. Now I want to get into venous. So these start at the heart again with the inferior and superior vena cava. And let's see if I have blue. I do. Okay. So with your heart, you have a superior vena cava that drains into your heart and an inferior vena cava that drains into your heart. And if you do want a reference, your aorta would kind of be like here. Okay. So here's your superior vena cava. Here's your inferior vena cava. And your superior vena cava splits into left and right brachiocephalic veins. Remember, brachiocephalic means head and arm. And the venous system is nice because it's very symmetrical. Okay, so I'm gonna keep it here for just a second. Your brachiocephalic veins split. Then we have our jugulars on each side. So you have an internal jugular external jugular. Internal jugular being more medial, external jugular. So here's your internal jugular, here's your external jugular, internal jugular, external jugular. Okay, internal jugular is being more medial if this is the midline, the neck, right? Then you have your subclavians out here. And your subclavians are going to go down the arm. Okay, so very symmetrical compared to the aorta. So let's take it down the arm. Okay, now veins. A lot of them are named the same as an artery, but they have more veins than arteries. So some of them are not named the same thing. So you have to be very careful. Now, if we take this subclavian down, notice how we have a branch off of it here coming all the way down the arm, way up here under the clavicle or the collarbone. So that branch goes all the way down the arm. That is called the cephalic vein. The cephalic vein is a superficial vein. You have superficial veins, you have deep veins. The superficial veins are the ones that people are going to start your IVs in and take your blood draws from. Most of the time, your deeper veins are going to be the ones for the very sick patients who need maybe like a midline or a PICC line or something like that. All right, so you have your cephalic vein going all the way down the arm, branch off the subclavian. Okay, now look here. As we follow the subclavian here, it becomes axillary. That seems familiar, right? And as we follow it down some more, okay, now we have this other branch going down this direction. That's going to be your basilic. That's kind of your partner to the cephalic. The cephalic is lateral or thumb side. The basilic is going to be medial or pinky side. So now we're going to have your basilic coming all the way down this direction. That's another superficial vein, one that they may draw blood from or start an IV in. Now in the middle here, we've got brachial veins. Don't mind that there's two branches. It really doesn't matter. These are deep. Okay, those are deep. Those are going to go all the way down here. Okay, now as they go down, one's going to go pinky side, one's going to go thumb side. Okay, so we have brachial, and these ones are the deep ones. This one is superficial, the basilic. Deep ones are going to be brachial. Also deep, brachial is going to split into radial. Oop, that should be ulnar. Radial is always towards the outside. Those are deep as well. Okay, now look here in the middle. Now, obviously this isn't to scale. I'm not an artist, remember. Look at what happens here in the middle. Your basilic connects with your cephalic just briefly, right? That's called your median cubital vein. So that median cubital vein is another superficial vein that they might like to draw blood from. See how messy this is? So your ones that have the same name as your arteries would be your brachial, your axillary, your ulnar, your radial. But now we have these extra superficial veins in here. Remember that most of your blood is in veins at any given time. So you have more veins than arteries in your body. So you might need to just make a note here that the deep ones are going to be your brachial, your radial, and your ulnar, and your superficial ones are going to be your cephalic, basilic, and the median cubital. So just make yourself a note. And then you have palmar, obviously, down here, just like with the palmar arteries. Okay. All right. Let's keep going here. So veins of the abdomen, this one gets a little hairy. So we talked about descending aorta, right? Kind of the partner to the descending aorta would be the inferior vena cava. So I'm going to take that one first. And when you draw your inferior vena cava, you are coming down and then you're going to have your common iliacs just like with your abdominal aorta. And we start actually with renal. So we don't have a cephalic trunk, we don't have an SMA on this, or a superior mesenteric on the inferior vena cava. I'm going to get to that in a second. We do have renals. The other thing that you have is gonadal. One's off of this renal, the other one's here. So one gonadal vein actually comes off your left renal artery or vein, and then the other one comes off the inferior vena cava here. Then you just have your common iliacs. And keep that handy for going down the leg in a second. Now, what about the inferior mesenteric? What about the superior mesenteric? What about the hepatic? What about all those? We have this hepatic portal system. So I'm going to draw this separately. This hepatic portal system would lie on top of all of this. And you can literally peel the hepatic portal system off because it's all connected to the liver, and see this, like if we were doing a cadaver dissection. Okay. So what does that hepatic portal system look like? A mess, right? Of course. So I always like to start by drawing my liver. And you have a hepatic portal vein here that enters the liver. And off of the hepatic portal vein, we have a vein coming down here that's draining the right side of our intestines. So that's got to be the superior mesenteric vein. You're going to have a vein going this way that's draining the left side of your intestines. So that's the inferior mesenteric vein. Then we have one going this direction over here, and that's going to be your splenic vein. Why do we need this? If you think about deoxygenated blood going back to the heart, okay, look at the common areas that these veins are draining. They're draining your intestines. Also, you do have a gastric flowing in here if you want to add a gastric. And your spleen. I always think of those as kind of dirty regions, or a better way to think about it is nutrient dense organs, especially in your intestines here. The point is, for all that deoxygenated blood, eventually it's going to go to the heart, right? But the point is for all of this deoxygenated blood to go through the liver first for any additional processing, meaning waste discarding, filtering, nutrient absorption that maybe didn't happen down here yet. All of this stuff needs to go through the liver before it goes back to the heart. Okay. And inside the liver, there's all kinds of veins, hepatic veins. And so if you remember directionality, all of this blood is moving towards the liver into this hepatic portal vein, entering the liver. Then the liver is connected to the inferior vena cava back here. And now it's going to go back to the heart. This lies over the top of your inferior vena cava here. So if you did want to draw the inferior vena cava with those branches, you'd have to draw it like behind here, like in here. This lies on the top of it. So if you peel that up, then you could see your inferior vena cava with your renal arteries and your gonadal arteries. Those are just not shown on this picture. They would be here. So this one is with the hepatic portal system removed, right? Your liver would be here, and the hepatic portal system that's more superficial, so it would be here. If you peel that back, then you have your inferior vena cava with your renals and your gonadals. I know it's confusing. All right, so let's take it into the leg. I'm gonna let you guys draw this one. So if you follow your inferior vena cava down into your common iliac, again, we have an internal and an external iliac. The internal goes into the pelvic region. We're not following that one. We're gonna follow the external. You have a branch off your external very early, called the femoral, and then a branch off your femoral here or excuse me, the external iliac becomes the femoral. Then we have this branch that comes off the femoral, kind of like with the subclavian. Remember that the cephalic vein came off the subclavian very high up. Same here. So off of the external iliac, you have this branch coming off medial side of the leg. That's called the great saphenous. It's the longest vein of your body. A lot of times they'll take grafts from the great saphenous to do any type of vascular grafting that they need to do. So great saphenous comes down, follows the entire medial leg all the way down. Follow the femoral. Again, it's going to cut to the back of the leg through the adductor magnus with the femoral artery. Arteries and veins usually go together, right? Oops, excuse me. And then we're going to go be in the back of the knee here. So we call it popliteal. That's the same name as the artery. If you follow popliteal down, you're following the posterior tib. You do have an anterior tib cutting through the fibula tibia to come to the front. Now, notice you just have two, right? So you have two anterior tibial, two posterior tibial veins. So it looks like a lot going on here, but you just have two veins to every, like one artery in this area. So if you follow the posterior tibial down under the foot, then you're in your plantar arches. And again, if you follow your anterior tibial down, then you'll be in your dorsal arches, which would be at the top. So some things are similar. One thing that the leg has for veins that it doesn't have for the arteries would be the great saphenous. And then you also have a small saphenous. My face is probably covering it. Yeah, here we go. Small saphenous goes to the lateral side of the leg. So small saphenous is going to go this direction over here. So it's a branch off of the small saphenous is a branch off of the popliteal. And the popliteal, so branches into small saphenous, that's going to go on the lateral side of the leg, where great saphenous is going to be running the full length of the leg on the medial side. Okay, so make sure you look at your book for stuff like this. It gets a little complicated. Let's go into veins of the head and the neck here. So head and neck, we have, remember your jugulars, your subclavians, go back to that image, okay? Remember that the arteries, you only had a common one here, and then that one split, right? For your jugulars, they both come off of this vessel here, which would be your subclavian, and where your brachiocephalic splits. And so you have your internal jugular, just like with your internal carotid, that one's going to go inside the skull and drain some brain blood in here, right? So venous sinuses are going to drain there. That's going to be all internal stuff. So that's your internal jugular. Your external jugular here is going to drain the occipital, the superficial temporal, and your facial here. So just keep in mind that the external and internal jugulars do have different branches. Ones that I would like you to know would be your external jugular, your internal jugular, and this occipital, superficial temporal, and facial. Venous sinuses might be on your homework just as a labeling blank for you. All right. I know that was kind of a long one, but way to hang in there. You only have one lecture left, and that's on the lymphatic system, but that is as far as we're going to go with the vascular system up into this point. So I will see you next time.